Opioids. Sometimes referred to as narcotics, opioids have been around for thousands of years and provide medicinal benefit to countless numbers of people all over the world. Derived from the opium poppy or manufactured to mimic the plant's natural properties, there are numerous natural, semi-synthetic, and fully synthetic opioids available. Opioids are indisputably effective at pain relief, yet they have other effects as well. They have an ability to ease emotional pain in addition to physical pain due to the way they alter perceptions of discomfort and encourage a kind of euphoria. They also suppress coughs and can cause constipation. Today we will focus on the physical effects of opioids, primarily the serious and most life-threatening effect they can have, the effect that opioids have on decreasing a person's breathing. The term used is respiratory depression, and it is the toxic effect that can result from taking opioids and is the usual cause of both accidental and intentional overdose. The United Nations Office on Drugs and Crime and the World Health Organization co-authored a paper released in June 2013, which states that globally 100,000 people die each year from opioid-related overdose. This is likely an underestimation due to lack of data and underreporting. Overdose is the leading cause of avoidable death among people who inject drugs, far exceeding deaths from HIV/AIDS or hepatitis. Ontario has the highest rate of prescription opioid use in Canada. Since 2011, death from drug overdoses in Ontario has been the third leading cause of accidental death in the province, with opioids being the drug most often implicated in these deaths. Sadly, 300 to 400 people die each year in Ontario from opioid-related overdose. In this video, when we talk about risk factors for overdose, we mean those that are implicated in accidental overdose. Though it is hard to tell sometimes, there is evidence that most overdoses are unintentional. Sometimes overdoses are not fatal, but they can still cause long-term damage. Today we'll talk about what increases the risk of opioid overdose occurring, and more importantly, what can be done to address these risks by providing a few harm reduction messages and tips. First off, what is a risk factor? Well, a risk factor can be a number of things. It can be a behavior that one engages in. It can be a genetic, inherited, or personal health characteristic. It can also be an exposure to something in one's environment. Today, we will not only list, but also categorize each risk factor to make them easier to remember. So let's get on with looking at what the known risk factors for opioid-related overdose are, and how we might want to group them in categories for ease of understanding and remembering. Tolerance. The first category of risk factors is, in a word, tolerance. That is, the degree of tolerance a person has. Tolerance refers to the way in which your body adapts to the regular use of a drug. With repeated use of substances like opioids, your body gets habituated or used to the drug effect. What happens is you build up a tolerance to the drug, needing more to achieve the desired effect. When we say that tolerance is a category of risk factors, what we are referring to are fluctuations in tolerance, reduced tolerance, or a complete lack of tolerance. We are particularly concerned with a person's tolerance to the respiratory depression effect of opioids. Lacking tolerance, or having no tolerance at all, is sometimes referred to as being opiate naive. This is a term that has been adopted by the U.S. Food and Drug Administration and is clinically accepted and widely used in the area of pain management. It is quantified by the FDA as patients who are not chronically receiving opiate analgesics on a daily basis. Opiate-tolerant patients are the opposite of opiate naive and are quantified as those taking a particular opioid for a week or longer, though the dose varies depending on the opioid prescribed. Opiate naivety, if understood as having no opioids at all in your system, means that a person is at risk of overdosing if they begin to use opioids and have not yet developed tolerance to the drug. Those who use opioids, both as prescribed and non-prescribed, develop a tolerance to the effects, both the positive and the adverse, over time. But tolerance begins to decrease when that person has had a period of abstinence. This is particularly important to know for those who have just left prison, drug treatment, or detox, because their tolerance will not be what it used to be if they did not have regular access to opioids. Along the same lines, tolerance is not the same for all opioids, and sometimes people lack what is called cross-tolerance for an opioid they are not used to taking. This may occur when someone switches opioids and begins to take a longer-acting opioid when they are used to shorter-acting ones. Methadone is an example of a very long-acting opioid. Studies have found that within the first 2 to 4 weeks of starting methadone, people are at greater risk of overdosing, and this is thought to be due to the fact that the person may lack cross-tolerance for the methadone. This is the reason why methadone providers will start low and go slow with the dosage of methadone prescribed. While starting methadone carries some risks, those risks are greatly lessened by proper prescribing practices. Methadone remains the most effective treatment for opioid dependence that we know. It is important to remember that not all opioids are created equal. Some opioids have greater strength or potency compared to others. It has also been shown that opioids break down into different numbers of metabolites that have varying degrees of opioid activity. For instance, heroin and methadone have been implicated in the greatest number of opioid overdose deaths, and some believe that since heroin breaks down into 3 different metabolites with opioid activity, it carries more risks of adverse outcomes, such as respiratory depression, than other opioids. One way to address the risk factors relating to tolerance is to initially use less of the substance. Sometimes this is called doing a tester. Beginning by sampling a small amount of the drug is especially important if you are switching opioids and when using heroin, given fluctuations in the purity of illicit supply. Doing a tester gives you time to gauge what kind of response you might have and how you will react. Remember, you can always take more. You can't take less after the fact. When you really take a deeper look at the risk factors, it becomes a bit more complex, because some research indicates that it is not the toxicity or the direct drug effect of opioids that one has to worry about, but rather the opioid receptors that exist in the brain. This still relates to tolerance, or lack thereof, but let me explain. Opioid agonists such as oxycodone, morphine, hydrocodone, and codeine are commonly prescribed for pain and used illicitly for their effect on consciousness. Opioid antagonists such as naloxone or Narcan compete with opioid antagonists to reach these receptors, hence the name antagonist. Agonists and antagonists do different things to different receptors. In an article published in Best Practice in Clinical Anesthesiology in 2003 by Shug and his colleagues, the authors discuss the fact that most adverse effects of opioids are mediated by the major types of opioid receptors, mu, kappa, and delta. In the same article, as well as another by White and Irvine that was written in 1999, it is pointed out that chronic administration of an opioid antagonist such as naltrexone results in an increase in the density of 3 receptors, mu, kappa, and delta, in the central nervous system. White and Irvine go on to cite other research by Milan, Morris, and Herx that was conducted with animals in 1988 that shows that this change in the receptors is associated with an increased sensitivity to opioids that are taken after the administration of these drugs. To put it in another way, there may be a hypersensitivity to opioid agonists after opioid antagonists have been administered, meaning this could be yet another risk factor for overdosing. This highlights the importance of being aware of what opioids you have taken or been given and when. Another risk factor relating to tolerance, but again, more so to the activity in the brain, is using in an unfamiliar setting. This risk factor seems to be less well known than some of the others and may be surprising to many people. Way back in 1983, a guy by the name of Shepard Segal interviewed heroin overdose survivors and discovered that the majority who had overdosed had used in an environment in which they had never used heroin previously. He went on to investigate the influence the environment had on overdose risk and has published many other studies that confirm the cues in the environment affect a person's tolerance and consequently your risk of overdose. Others have gone on to prove that using an opioid in an environment not previously associated with administration of the drug will be associated with lesser tolerance and hence a higher risk of overdosing. Another risk factor is about the way in which a person chooses to use, that is, the route of administration a person chooses to consume their drugs, with intravenous use being the route associated in some studies with the highest number of overdoses. Inhalation is another route of administration that is riskier than, say, ingesting or snorting. You may want to consider routes other than injection or even inhalation to lower your risk of overdosing. To summarize, tolerance is affected by the opioid taken, the personal level of tolerance one currently has, and the environment in which the person takes the opioid. To address these risks, one must be mindful when switching opioids, mindful of variations in opioid potency, and also be mindful of your surroundings. Try to take less of an opioid at first and consider not injecting or inhaling your opioids. Snorting may be safer, but taking them orally is least risky. The next category of risk factors is that of using or combining multiple drugs. Multiple drugs that have the same effect is even riskier. Side effects can compound together and accentuate the effects of the drugs that have been taken, both the positive and the negative. Opioids cause depressant effects within the central nervous system. That is, they depress things happening in the brain, such as control over breathing. Taking a bunch of opioids will increase the chance that this will occur. So will using alcohol or benzodiazepines and sedative drugs along with opioids, as all of these drugs have CNS depressant effects. It has also been discovered that taking opioids while taking certain selective serotonin reuptake inhibitors and tricyclic antidepressant drugs can also increase risk of overdose. Not because antidepressants depress breathing, but because they increase the chance of toxicological risk of opioid poisoning. In an alert that was sent to physicians and pharmacists in British Columbia at the end of May 2013, it was also pointed out that muscle relaxants, anti-nauseants, and anticonvulsants are often found in people's systems that have passed away from opioid overdose. That might sound alarming because many people who struggle with substance use can also struggle with mental health and be prescribed antidepressant and sedative drugs, and they may also have physical health problems that require these medications. The point here isn't to alarm you, but to encourage folks to always be mindful about what drugs you are taking, both recreationally and prescribed, and talk to your primary healthcare provider about what antidepressants and other medications you're prescribed and how they might interact with opioids. Physical health is another category of risk factors. There is literature that indicates that being ill, malnourished, or tired can increase your risk of overdose. That gets complicated and is highly variable, but it always stands that when you are not well, you are more prone to negative health outcomes. What we do want to point out is that having damage to your liver or kidneys is a risk factor for overdose. Your liver breaks down or metabolizes the drugs you put into our body, while the kidney filters. When the liver is damaged due to excessive drinking or hepatitis infection, it may not metabolize opioids properly. Kidney disease may lead to decreased elimination or filtration of the drug out of the body. If your liver or kidneys are not fully healthy, it may mean that opioids remain longer in your system and may build up, putting you at a higher risk of toxic effect. Another risk factor relating to one's health is having a respiratory illness such as COPD or emphysema. This poses a higher risk due to the fact that the concern is respiratory depression, as we mentioned earlier. So having an existing problem with breathing can increase your risk of respiratory depression when you take opioids. For more information on these and other related risk factors, I suggest you check out the work of Project Lazarus out of North Carolina in the States. The expert group which developed the Canadian guidelines for safe and effective use of opioids for chronic non-cancer pain include the elderly as one of the populations at higher risk for overdose. They explained that several pharmacokinetic factors put the elderly at higher risk for opioid overdose than younger patients, including lower serum binding, lower stroke volume, slows liver metabolism, and greater sensitivity to the psychoactive and respiratory effects of opioids. It seems counterintuitive that older age would put a person at risk of overdose, given that tolerance develops over time, and younger individuals who use opioids might be opioid naive in comparison to long-term opioid users, but older age has been correlated with greater risk of overdose in other cases. This further helps us to understand that the risk of opioid overdose is not simply about the drug or the dosage level of the drug. There are a number of intertwining factors that must also be considered. Location. Lastly, there are two other important risk factors to discuss. These alone do not increase your risk of overdosing, but they do increase the risk of a negative outcome should an overdose occur. They are using alone and using in a remote or rural area. If you use alone and overdose, no one will be able to respond. If you use in a remote area where it takes a while for EMS to arrive, then again, no one will be able to respond, or there will be a delay in getting you the medical attention you will need. To lessen this, use in the company of someone else, but always with your own single-use equipment, or tell another person that you are using and consider how accessible you are should you need help. You may not want to lock the door so that someone can come in and get you if they cannot get a hold of you otherwise. The fact is that you need another person's help if you overdose, because there are a few things that can be done to save your life. These include CPR, a shot or two of naloxone if it is available, placing you in the recovery position if you begin to choke or vomit, and most importantly, someone needs to call 911. Okay, let's review the risk factors that were addressed in this video. Tolerance, your body's ability to handle a drug and the fluctuations that occur due to a lack of opioids in one system, the way opioids break down in the body and the effect that they have on the brain, i.e. the effect they have internally. Remember, tolerance is also affected externally by the surrounding environment, and so where a person uses can also alter the amount of tolerance they have at any given time. Route of administration. The way a person chooses to consume opioids affects the risk of overdose, with intravenous use being implicated in the highest number of opioid deaths. Multiple drugs. Combinations of drugs are dangerous. Some are more lethal than others. Remember that the more drugs you take that have depressant effects, the more likely you are to depress your breathing. This might also cue you to the fact that antidepressants might be toxic when combined with opioids, so ask the person who prescribes them to you or a health professional you trust about the risk of overdosing on opioids. Physical health. Liver damage, kidney damage, or illnesses that affect your breathing can all increase your risk of overdosing. Also remember that when you are physically unwell in other ways, feeling ill or just getting better, being malnourished and fatigued also means your body can't handle and process the same amount of opioids you might be used to taking. Where you use and who you use with. Using in a remote area, and especially by yourself, means that it's going to be harder to recognize the signs and symptoms of an overdose, and there will be no opportunity to give you the assistance that you will need. If you observe, witness, or find someone you think is overdosed and that they use opioids, there are a few things you can do. Most importantly, you should call 911. First aid techniques such as full CPR, rescue breathing, or chest compressions can be effective. If the person is choking or vomiting, place them in the rescue position. Administer naloxone if available. Many communities now have take-home naloxone overdose prevention programs. Information about the signs, symptoms, and risk factors of opioid overdose can be found at www.OHRDP.ca. If you use or are prescribed opioids, be mindful of the risks and please take care of one another.